Thank you, Christine. Good afternoon, everyone. Dr. Strang will give you an update in a moment on the new COVID-19 cases in Nova Scotia. What you will learn is that this virus is still in our province, and we need to continue to be proactive and follow the protocols. The actions that we take not only protect ourselves, but will protect all Nova Scotians. Before I hand it over, though, I want to take a minute to acknowledge Richard Martel, who you see in the left-hand corner of your screen. The person you don't see is Debbie Johnson-Powell. They are ASL interpreters extraordinaire. They have been with us now since starting these briefings, and they're very good at what they do. And on this National Interpreter Appreciation Day, Dr. Strang and I want Richard and Debbie to know how much we appreciate them and how much we value their work, and thank them for providing this service to our hearing impaired community. We are very grateful to the both of you. Dr. Strang.
And echo, thank you both. You're incredibly important service that you provide. And good afternoon, everybody. Thank you, Premier. Today I'm reporting 7 new cases of COVID-19 in the province, bringing the total number of confirmed cases to 998. We currently have 5 individuals in hospital. 2 of those are in ICU. We have 661 of our total cases can now be considered to be recovered, so about 2/3 of our cases, which is really good news. We have 31,541 Nova Scotians who have been tested and have had negative results. As I started yesterday, I will now be reporting active cases only of COVID-19 in licensed long-term care homes and unlicensed senior facilities, instead of cumulative. It's just that the active cases gives a much better sense of what the current disease activity might be in our residential care settings. We have 3 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. Northwood in Halifax has 160 residents and 51 staff with active cases, while 2 other facilities each have 1 staff member with an active case of COVID-19. We do know that several Northwood staff have tested positive in the last few days, and we are doing an intense review of each of those cases to understand potential exposures for those individuals, what would be the likely source of them becoming infected. As part of that review is a deep dive into our current infection control and cleaning protocols to make sure that everything necessary continues to be done. Moving on to testing, the Qeii Lab processed 764 tests yesterday, so we still have a lot of people being tested, and fortunately very few positives. I do want to continue to remind anybody in Nova Scotia, no matter where you live, no matter where you may have been, that if you have symptoms that suggest COVID, so those are fever, new or worsening cough, headache, sore throat, runny nose, if you have 2 or more of those symptoms, we want you to reach out, do the 811 online assessment if possible. If you don't have online access, calling 811, and they'll take you through a more detailed assessment and direct you to testing if and as necessary. It continues to be important that a key part of our strategy is broad testing and identifying cases as early as possible in their course, and then following up with strong public health action around isolating cases, identifying and testing and quarantining all of their contacts, minimizing the opportunity for the virus to continue to spread. And so I think it's an important reminder that while we continue to see the bulk of the disease activity in the central zone and the HRM area, that it's important that all Nova Scotians, no matter where you live, that there is still the significant potential that COVID-19 could appear in any one of our communities. That if we let our guard down in any one part of the province, that potentially gives the opportunity for the virus to come back and to spread within your communities. So we need to continue to focus while we're talking about a recovery strategy, and we'll be talking more about that in days to come. It's critically important that we continue to also focus and not let our guard down, not weaken our resolve to prevent the spread of the virus. So we all need to continue to focus on good hand washing, not touching our faces. Those steps ultimately are what prevent us from infecting ourselves. We need to focus on, while we opened up outdoors, we actually want people to get out and be outside, but not together, only within your household group. It's not time yet to be getting together with people outside of your household group. So maintaining that social distancing, minimize, essential shopping only, all the things we've been asking you to do while we slowly open things up. It's important we still continue to protect ourselves and protect each other.
Thank you, Dr. Strang, and now we'll be happy to answer any questions.
Just a reminder for reporters that they will get one question and one follow-up. We will start with Natasha Pace with CTV.
Thank you. For Dr. Strang or Premier McNeil, the National Institute on Aging said that while the federal government put forward guidelines in early April, each province kind of adapted them at different stages. And they basically said Nova Scotia is now playing catch-up. I'm wondering where we are now today, if there's anything you think could have been done differently to slow the spread of COVID, specifically in Northwood.
So I think we outlined in detail our response around Northwood yesterday. We're certainly well aware of the National Institute of Aging, and we are also aware of those national guidance documents. As we outlined yesterday, every time we get a national guidance document, and I think it's important to remember it is guidance. Every jurisdiction then has to take those recommendations and understand the applicability, the feasibility, and then working with sectors on the practical issues around implementing them. We can't just take a guidance document and turn it around and say, now we're going to implement it. There's a bit of work that needs to go on. As we outlined yesterday, all of the federal guidance around long-term care facilities, around masking, those kind of pieces, we were one of the early adopters on that. I don't think there's been any substantive time lag between our own national guidance and our implementation here in Nova Scotia. Certainly around the masking piece, it was absolutely necessary that we did the hard work, as we talked in detail about yesterday, ensuring we had appropriate supplies of personal protective equipment before we adopted those masking policies.
Natasha, do you have a follow-up?
I do. Premier, I'm just wondering, Northwood held a press conference about an hour ago, and they mentioned they are starting to move some residents to single rooms. And, it came up yesterday about the fact that a lot of residents in that facility are housed with more than one roommate, or at least one roommate. Are you looking at any additional funding for Northwood to help them transition, or to help, I guess, fix the situation there so that there aren't double or triple rooms?
Yeah, thanks very much for the question. First of all, it's important to recognize that Northwood started using masks 2 days before those national guidelines came out, and the province of Nova Scotia actually isolated our long-term care facilities and prevented anyone going in that actually didn't work in those facilities ahead of Canadian provinces. In terms of Northwood and the infrastructure, obviously we're working today to deal with the issue of the virus and how do we continue to move those that have recovered out of the facility and then begin to isolate those who are positive away from those that are negative, so that we can continue to try to get that virus out of that facility. And I want to thank all those that are working on behalf of the Nova Scotia Health Authority, the Nurses Union, Unifor, those that have been working, and those that have been at Northwood for a long period of time. It's been gratifying to hear family members talk about the wonderful care that they've been receiving. But when this is over, we'll certainly be looking at what does that footprint look like, and is there something that can be done to continue to improve the facilities that care for our family members.
Next question will go to Ashley Field with Global.
Yes, hi, thank you. So I've been speaking with a number of family members or people who have family members in Northwood who tell me that their loved one has tested negative, but they're, on a floor in a room with those who are positive, and they say, it's just a matter of time before their loved one tests positive as well. So I'm just wondering if you can even say to them how this is maybe the most appropriate response in dealing with that.
So as I outlined yesterday, we know that from experience already in Northwood that that people who test negative may within a few days actually test positive. It doesn't mean they have an ongoing exposure, but it takes some time for the virus to replicate, but they've already been exposed. So certainly I've had the conversation with Northwood. They are doing what they can when somebody, as much as possible, keeping people negatives and positives separated, but also they're well aware that when people are living together, one is positive, one is initial test is negative, that in all likelihood that person who's negative is going to test positive within the next few days, and then moving them into somewhere may actually then take the virus with them. They have some of their floors which they haven't had any virus activity, so they're also very cognizant about moving patients around, even though their initial test may be negative, that if you move them and then in a day or two they're going to be positive, you've now introduced virus onto a floor which previously didn't have any virus on it. So it's tricky and complicated. They're doing what they can, but also being cognizant of not facilitating further spread of the virus throughout the facility as well.
Ashley, do you have a follow-up?
Yes, I think to follow up on Natasha's question, you said, you can't just take a federal guidance document and turn it around and implement it. I'm wondering if you can just explain that a little bit more as to why, especially in terms of maybe making the masks mandatory. If we had the masks, why could we not just, even as a precautionary measure, get them to wear them?
So certainly the guidance on masking, the most important step was to assess what are the implications of that in terms of our supply of masks. There's no point in pushing out a federal guidance and making that whether it's guidance or a directive in the province if we don't actually have the masks to do that. Then we have to work through the logistics around getting masks to all these facilities, education and awareness. It's not as simple as just putting a mask on. Even a basic surgical masks need some level of training, and some of the in a long-term care facility, not all of those healthcare workers would have experience wearing a mask. So there's a number of steps that have to be put into place, even if there's a guidance document that we agree with. But we, as I said, we just can't turn that around overnight. There's a number of things we have to assess. What exactly you assess depends on the guidance, but it's not as simple as saying yes, we agree, we're going to go ahead and do it. We have to take a bit of time, but again, I echo what the Premier said. Northwood on their own was ahead of the national guidance on masking, and it was only a space of a few days between the federal guidance and the province producing the directive on masking, and we were even distributing masks a couple of days before we actually pushed out that directive.
Next question will go to CBC's Shayna Luck.
Hello. My first question is for Dr. Strang. We now know that asymptomatic or very mildly symptomatic cases are possible. We seem to have capacity for more testing. What are your thoughts on doing randomized testing to determine spread among people who are not showing symptoms?
So certainly, when we look at the science on the test, it's every time if you go into every test, you have to be aware of what is the potential, what is the likelihood of somebody having a positive test before you even start to do the testing. And the lower the likelihood of a positive test before you even start, the greater the likelihood of errors in the testing. That's just simple statistics. So it's been looked at extensively, and certainly the science around just testing a large number of people asymptomatically is not actually shown to be a very effective way to be using that test because of the number of false results that you're going to get from that test. We continue to look at our testing is based on first and foremost people with symptoms early, but we're also looking at how we for instance, so we're doing all of our contacts. We test them regardless of symptoms because they have a higher likelihood of having a positive test. Therefore, the test is more accurate even if they're asymptomatic. So we continue to look at ways we can use the test and to get information and kind of what I call active surveillance for the disease, but just broadly testing a large number of people people who are asymptomatic is actually not an effective way to use this test. And we've discussed that at a national level. All the chief medical officers are in full agreement on that.
Shana, do you have a follow-up?
Yes, my second question is for the Premier. Given that critics say the long-term care system has been underfunded, under-resourced, you've faced criticism for not expanding the number of care homes in the face of urgent need. Does the government bear some responsibility for what's happening at Northwood?
Well, we continue to work with our long-term care facilities across the province, as we've done with all institutions when it came to this virus, following the advice and support of public health. Like I said, we're leading the country in some of the measures we took when it came to locking down long-term care facilities. Your first question in around asymptomatic individuals was one of those that nowhere in the world do people fully understand what would happen and the impact, and we know that's what's happened at Northwood. Asymptomatic people brought that virus into the facility. We've continued to invest in long-term care. As you know, there's 120 beds we're adding in CBRM, plus an additional long-term care facility in Eskasoni, the ones we're doing in Mahone Bay as well, increasing beds in the Clare region. We've reduced the wait list by half in the last 6 years. But we'll continue to look at, as I said in one of the questions earlier, the infrastructure. Northwood is the largest long-term care facility east of Montreal. I think there's lots of questions around the size and the magnitude of that facility, whether or not that's the appropriate way we should be delivering long-term care, or whether they should be smaller facilities. All of those questions will be asked as we go forward and continue to look at. But I want to thank all those in the long-term care facility who show up every day, caring for our loved ones and providing them with top quality care. And we look forward to chasing this virus out of Northwood, and then looking at how can we make sure that if this virus rebounds, or if a future one comes, that the physical setup that we have is the right one to ensure that we can control and prevent it from getting in.
Next question will go to the Canadian Press's Keith Doucette.
Thank you. Dr. Strang, when you were running through the numbers, especially for Northwood, you said that several of the workers there had become infected in recent days. I'm wondering if there's any significance to that particular development, or is there nothing you can read into that at this point?
So that's where we're at. That's why I said we're aware of those cases, but that's why we're doing an in-depth review of those cases to really fully understand where could they have been exposed. That they live out in communities. We do have some community activity, so one source of their exposure could have been out in community. It could have been also if there were breakdowns in infection control or their own use of personal protective equipment, and I do not at all say that in a blaming way. But we need to really, before we jump to conclusions, that we need to understand where the likely source of exposure in that, and what that then tells us, whether it's community or in the facility, about what more we may need to be thinking about doing.
Keith, do you have a follow-up?
Yeah, this one's for the Premier. Premier, apparently some kind of aid package is coming for fisheries within the coming days, according to the federal minister. I'm wondering what you think it needs to address in terms of the fact that, many fishermen, because of the way their businesses are set up, they're not exactly conventional. They don't qualify for a lot of the programs that are out there now. So I'm wondering what you're looking for in terms of what you know and what the province might do to augment what may be announced at the federal level.
Well, Minister Caldwell would have been dealing with most of that. I have not been briefed on what the potential proposal is. I can tell you what we've been able to do here is defer stuff through the Fishery Loan Board. As you know, we have built an export business here, driving tremendous exports through our fishery. We need to have a sense of what does that look like if we, in the supply chain, have a lot of supply that we can't move. We have to start looking at what does the fishing season look like? What do we do with new supply? Is there a way that we would look at communities? Is it appropriate for us to even be fishing at that period of time? All of those questions would have been stuff that would have been debated and talked about with the national government. As you know, the federal fisheries minister is a Nova Scotian, represents the South Shore, which is an active, probably one of our most lucrative lobster fisheries. So I'm looking forward to seeing what they bring down, and I hope, quite frankly, it's flexible. Because it will be, as you know, depending on where you are in this province, it's a very different season. So we need some flexibility is what really I'd be looking for tomorrow.
Next question will go to All Nova Scotia, Brian Flynn.
Hi, Premier. The Leader of the Opposition is calling for the province's health committee to be convened to look into Northwood, and the President of the NSGU is asking for a public inquiry. What do you think is an appropriate way for Nova Scotians to get answers on the COVID-19 outbreak in the facility?
Well, in the middle of a pandemic, I think they should allow public health to continue to do their work. We need to continue to focus on dealing with this issue, not only the spread at Northwood, but ensuring that we continue to flatten the curve across our province. We have business owners who have been closed now for months, looking at restarting the economy. How do we continue to make sure that what are we going to do around the opening of schools? What do we do with daycares? How are we going to try to put some level of normalcy back into this province? Those are the things I'm focused on and following the advice of public health.
Do you have a follow-up, Brian?
I do, thank you. Dr. Strang, you mentioned Friday that the province has a phased reopening plan. Wondering, when do you expect the next phase to take place, and when might the final phase eventually take place so the province can completely get back to normal? Sort of what are the parameters around that?
So the parameters are really, there is no timelines on that, because it's got to be driven by how each step in the opening and the recovery strategy, how that actually impacts the epidemiology on COVID-19 amongst a number of other factors. So right now we made some small steps in opening up the outdoors last weekend. As I've said previously, because of the incubation period of this virus, that you need to await, one and ideally two, a minimum of one, and ideally two incubation periods. So that's up to 28 days to see the impact of even our first step on if they're opening up the outdoors even in a modest way has resulted in increased COVID transmission. That to me tells us that we're not ready to go further. And so each step has to be governed by what the epidemiology of the previous step or the impact of the previous step shows in the epidemiology, and that takes ideally upwards of that 28 days. So that is an incremental progress, and I'm not going to kind of guess when we might get to the end of this because there's so many variables in between. It's going to have to be step by step, and that's the message as we're starting to engage a number of sectors about having them understand the time frame and how this has to move sequentially, but slowly and carefully, and governed by the epidemiology and other things we need to consider. And I would also end by saying that I think we have to understand that the even what you said at normal at the end, that's going to be a new normal. There are some things that are going to have to continue for a long period of time, like social distancing and other pieces that become part of our new normal. But I also think that there's opportunities here, things that we have done, like increasing access to virtual care, more people working from home, more caring communities. How do we sustain some of those positive things that have been put in place as part of the response? But I've said this previously, things will be different, but if we do things well, how that different can also be better in a number of ways.
Next question will go to Frank Campbell with the Herald.
Thank you and good afternoon. So we understand that there's a drive-through test site in Dartmouth. Just curious about where it is and how many other drive-through test sites exist in the province.
That is, I'm not sure it's accurate to call it. It's not actually a drive-through. We've created a large container, which is on the grounds of Dartmouth General Hospital. So people are going through there and are able to get swabbed through that container facility. It means that they're not having to come into the hospital. That is the only one of those that we have. We don't have any true drive-throughs. We do have other kind of mobile testing operating capabilities that, if necessary, through EHS and in rural parts of the province, now we have VON, if necessary, that we can actually bring testing to people.
Frank, do you have a follow-up?
Yeah. So, how many people have been tested at that Dartmouth site, and what is the criteria for someone to get tested there?
I don't know how many people have been tested there, but the criteria are no different than any other assessment site. We ask anybody who thinks that they may need to be tested for COVID, and I've outlined those symptoms earlier, that they go through 811, whether it's online is preferable, if not through the telehealth. Then they'll do the telehealth assessment, and if somebody needs to have tested, 811 will give them the direction of where the closest testing assessment site is in their community. If there are specific circumstances that 811 becomes aware of, then we can certainly, in consultation with EHS and with public health, we can use some of our mobile testing capacity where there's an individual with mobility issues or a single family where a large number of people need to be tested. The other thing we've done is that if we have a community where there's concerns about potentially increased COVID transmission, and we've done this in a number of communities and we'll continue to do this as necessary, we'll stand up temporary assessment sites, whether it's bringing in some physical infrastructure, or as we've done so far, we've used existing infrastructure within communities to create a temporary testing facility.
Next question will go to Genevieve Normand with Radio Canada.
Yes, hi. My questions are for the Premier. I know other reporters have asked you questions about a public inquiry. Quebec did so for a couple of seniors' homes, but I find your answer to be unclear. So why not launching an investigation into the situation at Northwood?
Well, we have been ongoing, looking at what's happening. Very clear. Been frank. Been here with Dr. Strang every day, practically since the beginning of COVID, with briefings. I know Northwood had a briefing today, laying out the issues that were faced there. And we're continuing to focus on ensuring that we continue to focus on the virus and chase the virus from here. It would be highly inappropriate in any form, in my view, to have people focus on anything else but this virus, so that we can eradicate it, get it out of our province, and quite frankly, begin to start rebuilding our economy. There's a lot of family suffering. We've closed businesses. Incomes have been lost. In some cases, life savings have been lost. How do we continue to do that? And in this case, we'll continue to look at our long-term care sector across the province. All of that will be reviewed. As you know, this virus has been in a number of our facilities. We've been able to control it in all of them, except for Northwood. And we'll continue to look at that, and we'll continue to work with our partners. But first and foremost, we're going to work with them to focus on getting rid of this virus.
Genevieve, do you have a follow-up?
Yes, I do. Thanks for asking. If there was going to be another pandemic, let's say in a couple of years, what would you do differently to better protect Nova Scotians, and specifically the residents at Northwood?
Well, what we did through the very beginning, as I've said in many of these questions, we led the country in locking down our long-term care facilities. In Northwood in particular, we had PPE out ahead of the national recommendations. That's Northwood was working with their employees. I think it's also critical to recognize that around the world, the theory was that asymptomatic people couldn't transmit the disease. We now know in the middle of this that's not accurate. We base at every step of the way, public health uses the information they have and the knowledge that they have, that they've learned as this virus has gone around the world, to continue to update the protocols and procedures. And that's what has happened through this pandemic in our country. If you look at what started in British Columbia, the way the protocols have changed, they worked their way across the country, and the same thing has happened here. We were following the best evidence from public health, not only in Canada, but quite frankly around the world, on how do you best treat and protect the residents in not only long-term care facilities, but how do you prevent community spread? And if there's a pandemic, if there's another virus in 2 to 3 years, we'll be using the updated advice and protocols that will be in place and lessons learned from what's taking place now.
Next question will go to News 95.7's Katie Hartai.
Thank you. What what is being done locally to track the inflammatory syndrome associated with COVID-19 that's being seen right now in children?
So we've had conversations with our colleagues at the IWK. They're well aware of that. Fortunately, we've had no children hospitalized because of this virus, but they're well aware of that. Any child who was affected by that, in all likelihood, would end up at the IWK. So there are certainly IWK is part of a network of pediatric hospitals that does active surveillance on a number of issues. So they're well aware. And I'm sure they'd be, part of national surveillance on this newly recognized syndrome.
Qeii, did you have a follow-up?
Yes, please. A group of scientists has found COVID-19 has mutated into a new strain that might be more contagious than the original one. I'm wondering, Dr. Strang, if you think we should be worried about this.
So that's the first I've heard of that. I'm going to look into that a bit. All this stuff does come to our national table. There's lots of theories out there. There's been all sorts of information about this treatment works or this is true about the virus. A lot of that turns out to be not accurate when you look at it in more depth and actually allow a bit more science to evolve. But there are things like asymptomatic spread that over time we learned more about that, and it was true. So we're open to all. We have a very science evidence-based approach, and we rely certainly on the Public Health Agency of Canada to bring a lot of that information into our national conversations, which then informs all of our provincial responses.
Next question will go to Jennifer Henderson with the Halifax Examiner.
Thank you. I'd like to know when hospital services can resume. I'm thinking about people who've been newly diagnosed with cancer who can't get consultations or tests because they were diagnosed after COVID began, and people waiting for hips and back surgeries. We have 5 people in hospital across the entire province. When do you see hospitals being able to restore some of these procedures?
That is actually, the Premier has asked myself, the Minister of Health, Deputy Minister, and that is an active topic of conversation right now as part of our recovery strategy. How do we open up our hospitals? But I have to remind you, think like urgent cancer care and other things were never shut down. Those continue to remain urgent, and emergency care continue to remain open. But certainly active work right now about how do we open up both our hospitals as well as community-based care providers, whether it's family physicians, physiotherapists, a whole range of regulated health professions who work in communities. So that is an active part of our recovery strategy and the consultations we're doing right now.
Jennifer, do you have a follow-up?
When can we expect an answer on that, Dr. Strang?
So I know that certainly within there are discussions right now with the health authority going on, and through the deputy minister. And I don't have any details on that, but it's certainly been identified as an urgent need to start to actually, as a first step, how do we actually open up our hospitals for things like day surgery, the elective surgeries that don't necessarily require long stays in hospital, because we also have to be careful that we don't completely open our hospitals right away and then we don't have hospital capacity if we do get a surge of COVID. But it's clearly everybody knows that this is a very important and urgent action that needs to happen. And so I would say in terms of timelines, nothing exact, but moving very quickly on this.
Next question will go to Kyle Shaw with the Coast.
Hi. I've got a question for the Premier about universities. Do you know how the universities across the country are deciding whether or not to have in-person classes or distance classes in the fall? Will there be a national decision or provincial decision, or will each school make its own decision?
No, I don't know where that is at this stage. Universities are, as you know, independent entities from government. All of the university presidents would be collaborating in our province, which they have been doing for the last 6 years with our government working very hard to help build an economy and attract more people to our province. It's why we've been able to build our immigration. But what will happen in the fall, each university, I'm sure in collaboration with one another, will talk about that. And at the same time, they'll talk at their national table and look at what is the best way. They'll see where this pandemic is in September and what are the best ways to be able to deliver the top quality education that our institutions are known for while following public health advice.
Maybe I can just add to that. I was certainly involved with my colleagues at Labor and Advanced Education as we quickly closed down universities. Already identified that as a broad, or the next few weeks as we do broad sectoral consultations, that myself working with senior colleagues in Labor and Advanced Education, working collaboratively with all our Nova Scotia universities and the community college on what the fall may look like is certainly a key priority in the next few weeks.
Kyle, do you have a follow-up?
Yeah, I'm just looking for your opinion here. When do you think it's fair to let students know they will or won't be expected to move to campus? Like, what sort of time, just as you as parents, when do you think that decision needs to be made?
Parent, the first thing I want Dr. Strang and all public health officials in government is to do what they believe is safe for my children. And we will follow their advice. I don't think anyone should try to put pressure and force and rush a decision around the health and safety of Nova Scotians. We will, as tough as this is and as difficult as this is and has been on families when it comes to their own economic security, as tough as it has been on families with children in public education system, as tough as it's been on people at post-secondary institutions, the most critical thing and the thing we've remained focused on has been the health and safety of Nova Scotians. And that will be what drives our decision. And it will be based on evidence. And we'll continue as a government to work with public health. And we'll communicate, as we've been doing through this entire pandemic, every day, and tell Nova Scotians what we know when we know it. And we look forward to working with them to help find our way through this. They've been helping us to ensure that we flatten the curve. And the sooner we do that, the quicker we'll be able to give people answers around what the future looks like.
That's all the time that we have for questions today.
Thank you, Tina. Today we talked about, as we do at each briefing, the impact of COVID-19 on our province. But the helicopter crash off the coast of Greece last week has also had a huge impact on us. In just a short while, a repatriation ceremony will take place, where 6 members of the Canadian Armed Forces who lost their lives will be honored. 3 of them were from Nova Scotia, but they were all members of our communities and made us all proud. I am told they loved what they did, they loved their fellow servicemen, and they loved this country. And that's why they chose the Armed Forces as a career. This has been a difficult time in our province, and we offer our condolences to their families. And as we do that, let us remind ourselves today to take a moment to mourn their loss and honor their legacy. They served their country, they served this province, and we will be forever grateful.